This is the Invite Health Podcast, and I am Amanda Williams. On today's episode, I am going to talk about cranberry extract. This is such a unique fruit in terms of all of the powerful antioxidants that are contained within the cranberries themselves. Now, oftentimes when we think about cranberry, we get focused in on urinary tract and bladder health, and that's not a bad way to think, but I want to give you some insight as to other beneficial things that cranberry extract can do for your overall health and wellness. But before we get started, just a reminder for you to subscribe to the Invite Health Podcast. You can leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. All of the information on today's episode will be linked in the episode description, and you can visit invitehealth.com/podcast for more information. So let's get right to it. Let's talk about cranberry extract. Now, there is a difference between cranberry juice cocktail that most people are used to seeing at their grocery store and actually having cranberry extract. The cranberry extract is what is really packed with all of those powerful polyphenols, those flavonoids, the anthocyanidins, the catechins, all of these chemical constituents that are really responsible for giving cranberries that tart taste, but also giving cranberries all of these health benefits. So when we think about this in more detail, we can recognize that as Americans, we generally don't have a high intake of cranberries. Most people maybe have cranberry relish or something similar to that right around Thanksgiving, and that might be it for the rest of the year for you. And you may turn to the cranberry juice cocktail, which I do not advise, because then we're taking away all of the benefits of those powerful antioxidants and we are covering them up with sugar. So we definitely don't want to be going down that path. But when we see the way, dietary-wise, the way that those cranberries can actually really give this supercharge of support to our system, it really is very, very impressive. Now, when scientists first started to research cranberry extract when it came to urinary tract health, what they initially thought was that the cranberry itself was somehow inhibiting the growth of the bacteria in the urine. So they thought, okay, well, people are taking the cranberry and somehow this is wiping out the bacteria from being able to grow in the actual urine. But then they found out cranberry is actually doing something completely different. And I always describe it kind of like a slip and slide. Most people have thought about that when you were a little kid. Maybe you had a neighbor or friend, someone who had a slip and slide, put the water on it and you run through the grass, jump on that and slide on down. Well, that's basically the same concept of what cranberry is doing inside of the urinary bladder. It is creating this slippery slope. And when you do that, it makes it very difficult for these pathogens, such as E. coli, to be able to adhere to that bladder wall. So if it's just sliding right out, then that's a good thing. If it's adhering, now we're dealing with recurrent urinary tract infections. Now we know that it's estimated 60% of women at some point in time will experience a urinary tract infection. Now the big problem here is that most women don't just have an isolated one-time event of a UTI. Many women will have recurrent UTIs, and this can be extremely problematic because then they're continuously put on antibiotics, which is doing what? Obviously trying to take care of the E. coli that's creating havoc in the bladder, but at the same time, it's altering that healthy microbiome within the intestines, which actually leaves you open for potential for further infections. So it's really a problem for many people out there. And it's not just women. We know that men, especially as men get older, they are more prone to the development of urinary tract infections because of inadequate full bladder emptying. And so you will see UTI infections as a more common diagnosis in older men. So it's not just limited just to women. So do keep that in mind. So I want to tell you a little bit about some of the science behind cranberry and how beneficial it can be, obviously for urinary health, but the way that they have looked at cranberry extract, even in the setting of digestive health. We're going to talk a little bit about peptic ulcers because that really starts to make a lot of sense when you think about that slip and slide effect. And we're going to also look at how cranberry extract can be beneficial for your cholesterol, so for cardiovascular health as well. But we're going to take a quick break. We will be right back.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit InviteHealth.com/podcast or click the link in this episode description. That's InviteHealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at InviteHealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
And welcome back. So we are talking cranberry extract. So let's just jump right to it. Let's get into urinary tract infections because this is usually the most common thing that people think about when you think about cranberry. We know that lower urinary tract infections are very common. I mentioned that good 60% of women at some point in time in their lives will experience a UTI. And we understand that the way that a UTI occurs is you get this colonization of the tissues, followed by this passage of bacteria through the urethra itself. Then after that, what happens is you have this adherence. So the bacteria itself actually adheres to the urethra and to the bladder wall, at which point in time it starts to replicate. So if the immune system itself cannot rid the bladder and the urethra of that bacteria, then we are dealing with a urinary tract infection. So we know that the most common causative agent for a UTI is E. coli. And we know that the treatment usually is going to involve antibiotics. But that reoccurrence is the major problem. So people who have to continuously be put on antibiotics because of a urinary tract infection, that becomes an issue because number one, they can start to develop bacterial resistance. So the E. coli just doesn't even respond to the antibiotic anymore. Secondly, we are continuously altering our gut microbiome because while that antibiotic is wiping out the bad E. coli, creating the UTI, we are at the same time wiping out our good healthy bacteria, which can lower our immune defenses. So that is certainly a problem. So they've been looking for a very long time in terms of the management of these recurrent UTIs and looking for different types of prophylactic treatment. So one thing that they have certainly honed in on was cranberry extract and understanding that the cranberry is packed with all of these powerful proanthocyanidins. Now, if someone were to just eat straight cranberries, you're getting all of these wonderful nutrients, not just the antioxidants. You get an awful lot of vitamin C from it. You get some wonderful minerals, things like magnesium, for example, is found in cranberry. You get vitamin A, vitamin K. So there's a lot of different nutrients. Plus, it's really high in fiber too. So if someone were to just eat cranberries, which for many people that's hard to do because they're very tart. But if you were to do that, it really is packed with all of these wonderful, wonderful nutrients. But they started to look at cranberry when it came to fending off UTIs and understanding now that it is that slip and slide approach is what they need to target. If you create an environment that makes it inhospitable for the E. coli to actually adhere, then you're doing something right. And they now understand this about the cranberry. Well, what it is specifically in the cranberry is mannose. So cranberry has mannose naturally occurring. It's this carbohydrate. So the natural mannose that comes from the cranberry is what really is providing all of this supportive effect to be able to fend off E. coli. And it's not just the E. coli. We're talking about other pathogens as well that have been linked to urinary tract infections, as well as other infections. We'll get to that in just a moment. So looking at all of the different clinical research, and there has been an awful lot of clinical trials that have looked at cranberry extract and its clinical relevance for many different types of conditions, but most specifically looking at UTIs. And they have been able to pinpoint that indeed, when people are consistently using cranberry extract, number one, it's beneficial for active infections, but most importantly, when we think about that world of prophylactic, it is extremely beneficial for women who have recurrent, and men too, who have recurrent urinary tract infections. So really, really impressive research that is out there. I'm not going to get into the heavy clinical trials on this because there are so many of them, but certainly understanding that when it comes to UTIs, cranberry extract has been shown time and time again that it really has this extreme effectiveness. And I think that that's something that should be duly notated, that this is different than cranberry juice. Now, some of the studies on cranberry that have shown, that's not so great when it comes to UTI, that's because they're using the sugary cranberry juice. Well, bacteria and fungus and candida, they love sugar. So yeah, it kind of defeats the purpose if you're using cranberry juice with sugar in it versus a cranberry extract. So this we certainly know. When you look through the database of all of the different studies utilizing cranberry, it's really quite enormous in terms of the scope of research showing the true impact that cranberry can have when it comes to impeding the ability of those bacteria to actually adhere to that bladder wall and create all of those problems. So I'm going to tell you more about cranberry, but on the setting of health issues other than urinary tract infections, other than bladder health, because this is where I think a lot of times people don't realize just how beneficial cranberry extract can be for your overall health. So we're going to take a quick break, and when we get back, I'm going to tell you all about that. We will be right back.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
And welcome back. We are now going to talk about how it is that cranberry extract has been studied in other settings. So I had mentioned earlier GI health and peptic ulcers, and we now know so much more about peptic ulcers, that it's not just brought on by stress. It's actually created because of that really pesky bacteria known as H. pylori or Helicobacter pylori. When H. pylori takes over and starts to raise havoc in the stomach, this is when we end up with ulcers, as well as a greater risk for the development of stomach cancers. So they have studied the same concept. They said, okay, if the cranberry can create this slip and slide approach within the bladder, would it do the same thing in the stomach? And that is what they found. Really interesting bit of research that they did, where they were giving a group of individuals who had all tested positive for H. pylori infection and were at a higher risk than for gastric cancer, stomach cancer. So they were giving them cranberry extract, and they did this for 35 days. And then after that, they retested, and this is really remarkable. 15% of them, just after having cranberry, their H. pylori test came back negative, which tells you something. It tells you that the cranberry is definitely creating that environment once again, where it's making it very difficult for that bacteria to actually adhere. And when you think about a study like that, you say, okay, so you have this group of people who all have H. pylori, and 35 days of giving them cranberry extract, and then retest, and 15% of them, just from taking cranberry extract, now have negative tests. That's really impressive. And that was in the Journal of Helicobacter. So it's a whole journal that's just dedicated to H. pylori. That's how pesky that bacteria is. And they've linked H. pylori to Parkinson's disease. I mean, H. pylori is more prevalent than people recognize. I mean, anyone who's out there who's on a, proton pump inhibitor, acid reflux medication, and your doctor has not tested you for H. pylori, I encourage you to do so. It's an easy test. They can either do a blood test or a breath test, and you're better to rule it out than to just go about and keep taking your medication for your heartburn. Because if it is H. pylori, it needs to be properly treated, because H. pylori will cause peptic ulcers, duodenal ulcers, and is the number one reason why people end up with stomach cancer. Not something to play around with. So this is why I definitely stress that. But we do know that the cranberry, once again, can create that environment where it makes it difficult for that H. pylori to adhere itself. Now, we also know, being that cranberries are this very rich source of flavonoids, these powerful antioxidants, having those catechins in there, we also have recognized that it can be very beneficial when it comes to your cholesterol. And in doing so, the way that they're able to analyze this is through blood testing. So you have your bad cholesterol, which is known as your LDL, or low density lipoprotein. What we know is that if those LDL particles become oxidized, that is a big problem. That puts you at a greater risk for a cardiovascular event. So if you test your oxidized LDL level and you see that that's high, then you know, I'm not getting enough antioxidants. So what they've been able to determine, and this is with so many different antioxidants, vitamin E, they know, is very targeted towards oxidized LDLs, but we also know that powerful flavonoids such as cranberry can also be very beneficial. So in the Journal of Life Sciences, and this is not a new study, this is back in 1998, they said cranberry extract inhibits low density lipoprotein oxidation. They said cranberry extract is often used for the treatment of urinary tract infections, but the effect of cranberry extract on heart disease had not really been investigated. So they wanted to see if the cranberry extract would have any type of an impact on low-density lipoprotein oxidation. And they said when the LDL oxidation took place in the presence of cranberry extract, they saw a reduction in that. So they said this study suggests that cranberry extracts have the ability to inhibit the oxidative modification of LDL particles. Well, that's pretty darn impressive. You could be taking cranberry extract because maybe you have a history of having recurrent UTIs, but at the same time, you're getting cardiovascular benefit and you're getting GI health benefits as well. So many different utilizations for cranberry. They have actually even looked at cranberry extract when it comes to the health of our teeth and gums. We understand that the cranberries themselves, having these different special chemicals, these powerful constituents that could actually impede and reverse the formation of dental plaque deposits that can lead to tooth decay. So when we look about periodontal disease and we think about all of the things that we should be doing to support our oral health, cranberry, both in the whole food form, but also cranberry extract, may be a nice addition to your routine. And obviously, consuming cranberries in your diet, I have to stress that if you can somehow figure out a way to do that, just think about all that powerful fiber you're getting from that. And we know that the average American is really lacking in fiber. We're supposed to be getting 30 grams of fiber per day, and the average American gets 5 to 10, which is not that great, which is why we have so many pre-diabetics, so many people with heart disease, so much high levels of obesities. I mean, you can pretty much link everything to the fact that our diets are horrible, which is why we always want to adhere to a Mediterranean diet. It is the most beneficial. And in doing so, you can get exposure to things such as cranberry. Now, supplementation of cranberry definitely is something that I advise across the board for a variety of different health concerns. Certainly when it comes to urinary health, we do know that the cranberry extract is quite beneficial, but then we can look at it in the setting for other health benefits as well. So cardiovascular health, obviously, is going to be a plus. Also with digestive health. And I do want to stress that if you are on a proton pump inhibitor, one of those medications for your acid reflux, and you've never been tested for H. pylori, this is my public service announcement. Get that test done, because if you have it, you need to be properly treated. You don't want to let something like that linger. It is not a good idea. So how much cranberry extract should someone be taking on a regular basis? Anywhere from 1,000 to 2,000 milligrams per day is usually adequate, depending upon why someone's utilizing it. Your amount per day certainly could vary, but remember, it's that mannose is what really helps to create so much of that health benefit when we think about the urinary tract and creating that slip and slide. So that is all that I have for you for today on cranberry. Definitely don't overlook it, and don't just have it on Thanksgiving. Be open-minded and try to incorporate cranberries into your life on a more frequent basis. And thank you so much for tuning in to the Invite Health podcast. You can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Make sure that you subscribe. You can leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health. And we will see you next time for another episode of the Invite Health podcast.